Hello, my name is Charlotte and I'm a psychology student at the University of Limerick. Today, I want to talk to you about one of the most prevalent mental disorders in our society, the disorder known as depression. Now, we may all have said I feel depressed from time to time when we're having a bad day, but what do we actually mean when we say this? Well, writer and political activist Gloria Steinem has said, "In sadness, everything matters, and in depression, nothing matters." And while I love this quote, I believe it is important from a psychological perspective to clarify what depression means. Depression can be defined as a mood disorder that has cognitive, behavioral, motivational, emotional, and physical symptoms. It is estimated that 350 million people of all ages suffer from depression worldwide, and depression rates are twice as high amongst women than men. Many people already view depression as a consequence of the stressful life events we face on a daily basis, normalizing its presence in our society. But what are the consequences of this? Well, over 80% of people that have symptoms of clinical depression are not receiving any specific treatment, and the number of people being diagnosed with depression is increasing by approximately 20% every year. It may be by using depression as an umbrella term that we are medicating normal, everyday emotions such as sadness and distress. So let us see what is required for a diagnosis of depression. In order to be diagnosed with depression, you must have 5 out of 9 of the following symptoms for a period of 2 weeks. As you can see, your favorite character being killed off on a TV show doesn't quite qualify. So what causes depression to appear? Well, research through the years has shown that factors causing depression may include personality, environment, learned responses, genetics, attributional style, and many others. But here we are going to focus on attributional style as the predetermining factor underlying depression. In the late 1960s, psychologist Martin Seligman proposed a theory for depression which became known as the learned helplessness theory. He suggested that people believe that negative life events will happen to them no matter what they do. In 1989, psychologists Abramson, Metalski, and Alloy also proposed a theory for depression known as the hopelessness theory. This further built upon Seligman's theory of learned helplessness. They suggest that an individual's vulnerability to a disorder such as depression lies in their attributional style. That is, they assign negative events to global or stable causes. Depressed individuals experiencing hopelessness believe that they are devoid of resources to change the course of events. They believe that negative outcomes will always occur and that positive outcomes will never occur. Sounds pessimistic and dysfunctional, right? So how do we combat hopelessness? Well, a person's attributional style could be altered by challenging these hopeless or pessimistic thoughts. And one way to do this may be through a cognitive process known as learned optimism. Learned optimism challenges patterns of hopeless or pessimistic thinking while reinforcing an individual's inherent strengths. In a number of studies by Seligman et al. At the University of Pennsylvania, a resiliency program was implemented. These studies used learned optimism as a tool to increase the ability of students to handle everyday stressors by thinking realistically and flexibly. They then carried out a meta-analysis of these studies which demonstrated that learned optimism reduces and prevents the symptoms of depression. Well, that's great. So for depressed individuals, we just need to remove hopelessness and pessimism, and we will create a new breed of optimistic people, right? Well, that doesn't sound very realistic. It could be suggested that it would be best not to try and remove hopeless or pessimistic thinking, but instead implement an optimistic approach to challenge these thoughts. By doing this, it will allow a person to believe that they can credit themselves for their own ability to function in a positive manner. So what does challenging a cognitive process such as hopelessness in this way mean for the real world? Well, if dysfunctional thoughts and beliefs are an underlying cause of depression, then these dysfunctional thoughts and beliefs can be identified, challenged, and replaced by functional cognitions like those in learned optimism. So how do we challenge these thoughts and beliefs? Well, one way is through the process of mindfulness-based cognitive therapy. Mindfulness, I hear you say. Well, let me clarify. This doesn't mean a hippie sitting on a mountain. Mindfulness-based cognitive therapy is simply a portable tool, whereby a person is taught to realize that every situation is new. Employing this way of thinking can promote a greater sense of choice within an individual, further helping to build up a sense of learned agency to combat the disorder of depression. I hope you found the information here useful and that it has given you a more optimistic outlook. And remember, once you choose hope, anything is possible.
Created using Powtoon.